Welcome everyone. This is Dr. Jaitly, your cardiologist from New York, on your favorite video site, MuniMeterHealth. And we are featuring on several social platforms. Thank you for associating with MuniMeterHealth. Primarily, we are enhancing medical education and patient education, primarily for medical fraternity as well as for the general public, in order to improve the clinical outcomes, which we know is definitely going to occur when we combine these two. So without any further ado, this is a very short video today. I'm going to be talking to you about e-cigarettes. What are e-cigarettes first, and when were they invented? Well, actually, they came into effect only in 2003, more or less, around that time when a Chinese scientist came up with an idea to replace the regular smoking cigarettes, if you will, or the regular cigarettes, which obviously we know they cause huge harm to the heart by causing coronary artery disease. We call it CAD, and then of course cancer, and chiefly the cancer of the lung and several other organs in the body. So just be mindful that these are two harmful effects of regular cigarette smoking, obviously, and in order to replace that, and because we have numerous other modalities where we can ask these patients to quit smoking by either using a nicotine patch or gums are available, and then of course you have tablets which are available as well, and so on and so forth. And then of course there are other medications like Zyban, for instance, is available, and then Chantix. So these are the two drugs which have been approved by FDA to help quit smoking, obviously, because that's one of the reasons why the e-cigarettes have really developed also. So besides recreational use. So how does e-cigarette work? Basically, there's a piezoelectric ultrasound crystal which tends to vaporize an air liquid. So basically it works on vaporizing a liquid, and the liquid tends to vaporize in the form of an aerosol. And that aerosol, because say if this was a cigarette right here, it'll vaporize here like that, and so the person actually tends to believe that he or she is still smoking while actually not inhaling the smoke, but is actually inhaling the vaporized aerosol. We do not know, now here's the unknown, we do not know the side effects of in the long run of this vapor, so-called vapor. And of course vapor, because they inhale, it's also sometimes called vaping, and that has been a term that has been coined now for people who are smoking e-cigarettes, and so in fact it's called vaping. So we do not know the effect of the vaping, and especially long term. The short term, of course, like scratchy throat or sometimes nausea, vomiting, or even headache, those have been defined, but those are short term effects we know. Definitely the tobacco smoke, of course, from the smokers cigarettes, the tobacco obviously has huge contents of chemicals as a result of the nicotine that burnt within the cigarette. So those chemicals obviously are extremely carcinogenic, and we know that nicotine is injurious to several organs of the lung, and of course definitely the heart. So that is a given, that has been well established, except that we do not know the replacement, the e-cigarettes, will that have any long-term effects, good effects or bad effects. Have e-cigarettes been able to help quit smoking in very small percentage of individuals? Yes, but not a whole lot. It is still not FDA approved. It's not FDA approved. So in other words, doctors cannot write a prescription. They can write a prescription for patches and gums of the nicotines and the tablets and as these medications, Chantix and Zyban, but they cannot write a prescription for e-cigarettes yet. You can go and buy them if you like. But again, as I said, the effects and the side effects, especially in the long run, we do not know yet. So that's very important that again, whoever decides to do the e-cigarettes, be very leery of the fact that the vaporized aerosol that you will be inhaling We do not know what the contents of these are. We know that perhaps the contents may be less than 1%, as most literature is suggesting, of what the tobacco chemicals will contain. So it is definitely less than 1%, but still we do not know many of the chemicals yet, and they are uncertain. There are numerous flavors. Obviously you can get all these flavors, including a nicotine flavor, and that's why it's considered as a dual edge, because small young adults or young children can start smoking on e-cigarettes with a nicotine flavor, and as a result eventually go back to smoking here, and they'll become chronic smokers. So it's a dual-edged sword. It does help small percentage of people to help quit smoking, but it can also enhance the desire to become a chronic smoker, a real-time cigarette smoker, if you will, and that is very, very dangerous also. So just to let you know. So here was a quick video vignette on e-cigarettes. I hope this was helpful. Again, stay well and stay with MuniMeterHealth. Thank you again, and this is Dr. Jaitly.